In the U.S., a crush of COVID-19 patients is testing the healthcare system. Nearly 100,000 Americans are now hospitalized with the virus, and there are warnings of a surge on top of a surge as people who socialized over Thanksgiving get sick. At some point, hospitals may have to start turning sick people away. Jackson Proskow reports.
With hospitals at capacity, Rhode Island opened 600 beds in a converted convention center, as doctors and officials in multiple states warned their healthcare systems are nearing the breaking point.
We're anticipating it. There's not so much a worry of if it's going to come.
There are now more people hospitalized with COVID-19 in the U.S. than at any other time, with multiple hotspots spread across the country and a steady uptick in cases almost everywhere else.
There's only so many resources to go around. And, if the hospital, again, is filled with COVID patients, and strained for resources, you wonder about the quality of care the patients may get.
The issue isn't just a shortage of beds. There aren't enough doctors and nurses to go around. Those on the front lines today have been working nonstop for the past 9 months.
Patient after patient and changing of PPE and worried about your own health and your family's health. And these kind of stresses build up and over time lead to burnout.
As bad as things are, the worry is about what's to come. Millions of Americans defied pleas from health officials and traveled over Thanksgiving, leading to predictions that case numbers will soon surge even higher.
This pandemic is like a high-speed train. And our projections tell us that we are on target to derail by around the third week of December.
That's around the same time the first doses of a vaccine will likely be released to the public. Far too late to stop what will be the worst days of the pandemic. On Tuesday, the U.S. Centers for Disease Control met to discuss who will get the first doses of an approved vaccine. It's those frontline healthcare workers, the people who've risked their own health and safety and are about to face their biggest test in the coming weeks. Donna?
Jackson Proskow in Washington, thanks. Now to England, where a 4-week national lockdown ends tomorrow, but any relief is being tempered by the reality a new 3-tiered system of restrictions will replace it. As Redmond Shannon explains, that's led to confusion and complaints.
We're sick and tired of living in fear. We're sick and tired of being manipulated. And we ain't going to do it no more.
These protests may be the extreme end of England's lockdown frustration, but they are sentiments being felt to some degree across the nation.
This second lockdown has been tough because you're just building up your business again, trying to get back to a normal lifestyle, and then all of a sudden it's sort of taken away.
On Wednesday, England emerges from its 4-week lockdown. A new study indicates that it has worked somewhat. Infections are down 30% and continue to fall, but the sacrifices are far from over.
Huge sections of the country, particularly in the north, will now move to the highest of 3 tiers of regional lockdowns. People are advised not to leave Tier 3 areas, and bars and restaurants there will stay closed. It has stoked the old tensions between England's rich south and less well-off north.
How can the government justify giving Tier 1 areas the same level of business support as Tier 3 areas?
Some MPs in Prime Minister Boris Johnson's Conservative Party publicly demanded to see the evidence behind the tiered approach.
And I know that lots of people think that they are in the wrong tier, and I understand people's frustration.
As England loosens up slightly, neighbouring Wales tightens its rules.
Cases of coronavirus are beginning to rise in the over 60 age group in most parts of Wales.
Starting Friday, pubs and restaurants across Wales will not be allowed to serve alcohol, mirroring measures in parts of Scotland. The Scottish First Minister, Nicola Sturgeon, says healthcare workers there will get an extra $860 thank you payment for their work in 2020. She is up for re-election next year and is pushing for a new independence referendum. Redmond Shannon, Global News, London.